So kids can sometimes get overzealous in eating raw carrots and might develop that, although it would be kind of rare. Vitamin D is not an essential nutrient for us to have. Why would that be? Because you can get it outside from the sun. Your body has the ability to convert the sunlight to vitamin D in your body. So that way, that makes it more of a non-essential nutrient. Okay, it does have some things in the body that it's really important for, but it is more of a non-essential nutrient because we can make it ourselves. The activation of vitamin D from the sunlight occurs eventually in the livers and the kidney. And the active form is a sterol or a hormone, and it is taken to target organs, and those organs are typically the bone. And there's a big, significant relationship between vitamin D and calcium and phosphorus in the body. So all those things have to be taken in adequate amounts for us to utilize the vitamin D appropriately. It is associated with immunity. It's associated with neuromuscular function, insulin production, and an inflammatory response that we would have to a bacteria or an infection. So vitamin D is important in all those different areas. The overt symptoms of vitamin D deficiency are kind of rare. It is common for us not to get enough vitamin D, but it takes quite a while for us to develop overt symptoms that you can actually see. Some of the factors that contribute to that kind of insufficiency is if you're dark-skinned, you have less of an ability to change the sunlight to vitamin D. If you're a breastfeeding female and you don't supplement with prenatal vitamins, then you get vitamin D deficient. The further away from the equator you are, the more likely it is for you to be vitamin deficient. And then the milks that we drink nowadays, unless you drink wild milk, is going to be fortified with vitamin D and calcium. So it's going to have extra in it for that purpose. Now this is some of the signs that you can see, and I've seen this in kids, okay? I guess the one I remember the most was just walking in the airport in Atlanta, and a small child walking in front of me had such a severe case of rickets. I was like, I can't believe that kid is actually walking. But he was doing quite well. He learned to cope with his bowed legs significantly. And people that have rickets, and it's primarily children, is where you're going to see that development of the bowed legs. They're also going to have beating on their chest wall, on the ribs of their chest, and you can actually feel it, just like little bumps on their rib cage. So you can always look at that, and that will help you diagnose that at least when they were in the middle of growth and development. And that's something that lasts all through adulthood, is that beating on the rib cage. Osteomalacia is what occurs in adults, and that's just poor bone mineralization, and then of course osteoporosis, which I'm intimately aware of, is a loss of calcium from bones, and that eventually results in fracture as well. That can be genetic, or it can also follow a pattern in certain people. Toxicity, if you take it in too high doses, and this is something that, like I went to the doctor Monday, and I want you all to know, he told me that my leg was better healed than a 20-year-old. Awesome. He is very careful about how much extra vitamin D. So I'm taking about 6,000 extra vitamin D a day. But there is a limit to what we can do as far as how much can be taken. So you have to be very careful about prescribing more than, usually it's 4,000 for somebody who just has osteoporosis. They don't go over that. Chronically elevated doses of vitamin D can lead to kidney stones, and it can even lead, because you take calcium with that as well, it can lead to calcification of the blood vessels and cardiovascular disease as a result of that. high vitamin D level does significantly impact the calcium release from the bones, and so that's what can lead to hypercalcification in the blood vessels. These are just some of the recommendations for food sources of vitamin D, and a lot of people can reach what they need by making sure they drink fortified milk, making sure that they have plenty of oily type fishes. That's going to be like salmon and tuna and mackerel and that type of thing. And then make sure they get out in the sunlight at least 20 minutes a day without any kind of sunscreen being used. Kind of done ourselves in a little bit in that we worry so much about melanoma and skin cancer. We use so much sunscreen, and that significantly blocks our ability to make vitamin D. Vitamin E. Okay, this is important. Vitamin E is the most powerful antioxidant that you can take and eat. Vitamin E. It's found primarily in oils, so it's found a lot in fats. So if you are on a strict low-fat diet, you're going to have potentially a problem getting an adequate vitamin E in. But it is a powerful antioxidant, and a lot of physicians recommend taking supplementation of vitamin E just because of that, to make sure that their patients get adequate amounts of that. Because it does stop the chain reaction of the free radicals and can significantly impact our ability to fight disease and fight cancer cell replication. The effects of the deficiency, there's not a whole lot of, you don't see vitamin E deficiency very often. I've never seen that in almost 40 years. So, but it does cause the red blood cells to break open. So if you do see a patient who develops some strange petechiae in their skin over a period of time, you might want to look into what their diet is like and see if they're trying really hard to diet and follow a low-fat diet, because that might be something that results. It's also found in addition to oils, it's found in nuts and seeds. So if people take a good amount of their almonds every day, which is important for cardiovascular health, then you're going to get plenty of vitamin E. Vitamin K, one of its most important functions is in blood clotting. This is one that there's really not an RDA for, because our colons make vitamin K, and we don't really know. Typically what we think is that our colons make adequate amounts for us, but everybody is individual, so we don't know what a recommended daily allowance would be for a population, because it is so individual. The deficiency of vitamin K is going to be very rare as well. The only ones that are actually deficient in vitamin K are neonates. When they're born, when you all were born, you probably were given an injection, a one-time injection, because neonates have a sterile gut, and they don't have the ability to make vitamin K at the first of their life. So all of us got an injection, a one-dose injection when we were born, in order to supply us with adequate amounts of vitamin K. But usually the only time you're going to see a deficiency here is if somebody has fat malabsorption and they're just not able to absorb adequate amount of vitamin K in food, and they're going to be deficient. So it's kind of rare that you're going to see that. There are no toxicities associated with this, because it's so hard to get adequate, to get your amounts up so high. The one issue, and I have on there drug therapy, the one issue that we have a lot with vitamin K is because of anticoagulants that we use for different problems, for example, broken bones and that type of thing. Vitamin K interferes with Coumadin and those anticoagulants, because it does increase the blood clotting factors. The thing about that, and I have argued with pharmacists for many years. The thing about that is consistency. So what we typically tell patients who are on Coumadin and monitoring their INRs carefully is we tell them to have a consistent diet. So we don't eliminate vegetables, because that's where vitamin K is in almost, a ton of the green vegetables that people have. So if we said eliminate all the vitamin K in your diet, you're going to have an inadequate diet for a lot of different reasons. So what we typically say is to make your diet consistent in foods that have vitamin K. So we try to get people to not have 2 to 3 servings of, say, broccoli or a green leafy vegetable in a day. We try to get them to be consistent over time. 2 to 3 times a week you can have a green leafy vegetable. 2 to 3 times a week you can have broccoli and some of the things that are high. But we don't typically eliminate that. When we talk about TPN next week, for years we didn't put vitamin K in the vitamin package for TPN because so many of those patients had problems with, we had them on anticoagulants as well. And they were getting deficient in other things. And we're not really sure about the mechanism of action, but the American Medical Association said, you know what, from now on, you've got to add vitamin K to TPN. So IV nutrition has now got vitamin K in it, where for probably 20 years it did not. Okay, water-soluble vitamins. So you can take megadoses of water-soluble vitamins. Toxicity is very rare. What happens when you take megadoses of water-soluble vitamins? And you get really expensive urine that you flush down the commode, because it is really expensive. If you go into the pharmacy and you price some of those megadoses of B vitamins, and you can buy a lot of them singly, it can get really, really expensive. So keep in mind, if you've got somebody I had somebody the other day, it was a student, Monday, and she came up and she says, I am taking B12 every day. I take megadoses and then I take injections. And I'm going, why? Do you not have a stomach? And I'll explain that in a minute. And she said, oh yeah, I've got a stomach. It just makes me feel better. And I wanted to go, you probably could take a salt pill and it would make you feel better, sweetheart. No reason to take it, but was taking megadoses of vitamin B12. And a lot of people, that's the placebo effect, right? Y'all know what that is. So people will do that with supplements like this. So I just encourage you to kind of talk them down a little bit. Like I said, it's not typically going to hurt them, but the expense is tremendous. So if they are foregoing a good food in order to make sure they get their B vitamins pills in every day, you might want to talk to them a little bit about the feasibility of that. The B vitamins, and the reason I'm going to stress these is they are so important to our metabolism of energy and the way that we use carbohydrate, protein, and fat for fuel. If you don't have adequate B vitamins, you can't convert carbohydrate and fat and protein to the fuel that you need for whatever it is. So if you're pushing protein in order to build muscles, if you're not getting adequate vitamins, a lot of that is going to be wasted, because you have got to have B vitamins in order to convert that. They are coenzymes in all the different reactions that help us release energy and utilize protein. So let's look at thiamine. And a lot of these have, like I said, they have deficiency symptoms, but they don't really have toxicity symptoms associated with it. So thiamine deficiency affects a lot of different things, and it affects the GI tract. It causes anorexia and constipation. The stomach doesn't empty properly. Significantly affects the myelin sheath in the nervous system, so it affects neuromuscular function and sensation that we have. It can result in cardiac failure and edema and eventually death if it's not treated. The deficiency disease for thiamine is called beriberi, B-E-R-I-B-E-R-I. There is wet and dry beriberi, so I'm not going to get into all the differences for that, but just keep in mind that there is a deficiency syndrome, and it does take all these things into consideration, and if it is not treated, then that person can eventually die as a result of that. The requirements are affected by alcoholism in particular, and this is one of those, have y'all ever heard of a banana bag? Okay, so thiamine is one of those things that we add to a banana bag, and the reason, you know why it's called that? Why is it yellow? Yeah, the B vitamins, if you take mega doses of B vitamins, it will turn your urine yellow, extremely yellow, like orange yellow. So that's why we call that banana bag. That is because it does turn it yellow. Even TPN, when we put, because the B vitamins are such a big part of the multivitamin package that we put in TPN, it turns it yellow. So it'll turn that clear liquid yellow. So this is one of the ones that is more important in alcoholism. If you've got somebody coming in and they are encephalopathic, they've got Wernicke's encephalopathy, then you give them a banana bag in order to treat that. So it's really important. Beriberi is kind of rare as a deficiency disease, but you'll see in this patient population that are listed here, the alcohol, the elderly, people with chronic problems, it can decrease their absorption significantly, so that's why that they're going to need a little bit of extra boost when it comes to B1. B2 is riboflavin, and it is absorbed in the small intestine, but it has to be absorbed with phosphorus. So if you've got an inadequate phosphorus intake, you're not going to absorb B2 quite as well. Just like all of them, any extra that you take that your body decides it doesn't need, you pee it out. And if y'all remember the Krebs cycle, riboflavin is part of the flavoprotein in FAD and FADH that is in the Krebs cycle. So it's really important in growth and development, and then glucose breakdown as well. And this is a riboflavin deficiency, and it's very similar to some other deficiencies of the B vitamins. You're going to see a lot of these signs in all the B vitamins, and that's why you locate the sign, and then you have to run serum tests in order to determine which B vitamin is in deficiency. Or you can get somebody come in, take a nutritional recall, and they might be able to figure out where that deficiency is. But any kind of B vitamin deficiency, and in particular riboflavin, will result in these types of problems. And you'll see a lot of chelosis, which is the cracking at the corner of the lips. The glossitis is the red, beefy tongue. You know, when you all look in the mirror, you see the little taste buds on your tongue. With the riboflavin deficiency, if you just have them stick out their tongue, it's usually red. It almost looks like it's kind of bloody, and you cannot see the taste buds because it is so smooth. It looks more like just a piece of beef when they stick out their tongue. They will have dermatitis as well, so it's a really flaky type of dermatitis. And then newborns will have a high bilirubin too, if mom has not taken her vitamins appropriately. Niacin is B3, and niacin is one thing that can be converted from tryptophan, which is a type of amino acid. And it is important in NAD and NADH and NADP. So some of those reactions in the body that help us convert energy. It's another one that is important in those reactions. So it helps you convert protein and glycerol to glucose to yield energy from those. And if you'll remember, I think we talked about this when cardiovascular disease, niacin is the one that if you give them larger amounts, like a young person, I would be very hesitant. I'm sure pharmacy will take it differently, but I am very hesitant to put people on cholesterol-lowering drugs. There's so many side effects associated with that. So if you particularly got a young person, also try megadoses of niacin first because it does interfere with cholesterol absorption. Sorry. It is usually dose dependent, and you're going to have a decrease in LDL if you give them between 2,000 and 3,000 milligrams of supplement of niacin a day. You could do less if you're worried about triglycerides, but I would typically start with 2,000 and see how they do with that, of milligrams per day of niacin. And that's just kind of a first line treatment along with diet, and see if you can get that to work before you have to resort to medications. I'm kind of against medications right now. Sorry. Okay, this is one that I've actually seen, and it's kind of interesting. It involves the skin first. That's kind of one of the first signs and symptoms you see of a niacin deficiency. And then it involves the nervous system and the cardiovascular system. It's called pellagra, and this is the 4 Ds of pellagra in order of their appearance: dermatitis, diarrhea, dementia, and then finally death if it's not treated. And this is like, for example, okay, this little fella, did I tell you all this? I told another class this. This little fellow was a little guy in Appalachia, and his wife had died. And he was alone up in the mountains. His children had moved off, so he didn't have them immediately available, and they weren't able to check on him. So due to depression and the inability for him to get adequate food and prepare it, he got pellagra. And it was very difficult to diagnose because when he came into the intensive care unit, it was to the cardiac unit. And I had a great medical director who was a GI doc, and we kind of just started comparing the symmetrical rash and dermatitis that he had. And that's what's so weird about pellagra. It's not going to be rash on one arm. It is two. It's always bilateral. It's always bilateral. It's always going to look the same on both sides. And that's a lot different from a rash from another source. So if they do have dementia, they've got uncontrolled diarrhea, this guy was in a coma already. No. I would think so. If it's absorbable, yeah. I don't know what you're talking about. Sorry. You'll have to explain that to me later. Okay. But you can see in this picture this guy's hands, and their legs will look the same, and their arms will look the same. So that's kind of that should turn on your brain that this is not just your typical thing. So that's pellagra. You do have increased requirements in niacin when you're growing and developing during pregnancy and lactation, and then when people are sick and a trauma or stressful situation like that. So a lot of the formulas that we utilize in the trauma unit have increased amounts of niacin in them for that reason. Pyridoxine. It is involved in a lot of different reactions that make amino acids available to the body for different functions. So when you think of pyridoxine, just think of the reactions that it makes to make protein more available to your body. That's one of the most important things about that. Yes, carbohydrate and fat metabolism is important, but the most important thing is amino acid transport. A deficiency in pyridoxine can lead to anemia and problems with central nervous system. TB patients, the drugs they have to take can lead to a problem with malabsorption with pyridoxine, so you might have to supplement that patient population because of the drugs that they have to take. This is one that can have some toxicity symptoms, but they're very similar because they do affect the neuromuscular system. And the reason I threw this one up here is this is one of the ones we had no idea we needed until we started using TPN and we didn't put it in it. So pantothenic acid is one that doesn't have a deficiency state because it is in so many things that we get it if we eat. It's just the people that don't eat can't get it. And that's when we started seeing some deficiency signs and symptoms. Biotin is another B complex. It is absorbed in the ileum like most of them. And again, it's another one that we didn't really realize there was a deficiency sign or symptom until we started using, or not using it, in TPN. But that symptom is characterized by just skin inflammation and muscle pain that people would complain of, generalized muscle weakness, nausea, weight loss. So you can see it would be really easy to confuse a biotin deficiency with something else and that you would have to really investigate. And this is probably one that you really wouldn't look for if somebody was complaining with all those symptoms. That's not the first thing that comes to your head. It's usually something like cancer or malabsorption or something like that. Folate, we kind of hit on that one already about some of the importances of it, important reasons to have that. It's very important in carbon transfer and metabolism for energy, and it is a big part of the heme molecule in hemoglobin. It is important in RNA and DNA synthesis, so that's why it can have a significant effect on a developing fetus. And that's why OBGYNs are now telling women that are thinking about getting pregnant that they need to really boost up their folate levels, because that does happen in the first 6 weeks, and usually you don't even know you're pregnant at that time. This is another one that is added to a banana bag because it is deficient in a lot of alcoholics, more so in alcoholics than in the general population. So this is another additive in that banana bag. The food sources of folate, the best food sources are animal proteins. So it is one that you might have to watch a little bit more carefully if you've got a vegan that you're dealing with, and you might have to watch for symptoms a little bit more carefully. And I thought that it was important to say that this is one that does seem to play a role in preventing some cancers and some heart disease. Folate is required for the proliferation of cancer cells. It is required for division of cells. So sometimes a patient that is slightly deficient in folate might have a better response to chemotherapy. In fact, used to, and I don't know, it's been a while since I worked with oncology, that some of the chemotherapeutic agents actually had a folate antagonist because it would decrease cell growth if they took that drug. There's so much we don't know about vitamins and minerals, and there's so much that we still have yet to learn. And if you look at the data that comes out on a weekly basis, almost all of it is going to have some reference to a vitamin or a mineral and some new findings. So kind of keep that in mind when you're looking at patients. Cobalamin is one that and that's B12, and it has to be absorbed with a kind of a helper. So if you don't have a stomach, this is why I asked my little student yesterday, if you don't have a stomach, you can't absorb B12. Or if you have a partial gastrectomy, your absorption of B12 is significantly reduced. It's the thing that is produced in the stomach is called intrinsic factor. And if that intrinsic factor is not present, you don't absorb B12. So as people age, their production of intrinsic factor decrease. So that's something you'll find in the elderly is the deficiencies associated with B12. You also will find that in your patients that have had obesity surgery, gastric surgery. So you need to be careful. A lot of those patients are on mega doses of B12, and if they tell you they're getting thousands and thousands of IUs a day, what we have found out, we used to give injections. We don't do that as much anymore. We give mega doses because what we have found out is if we give them enough, they will absorb adequate amounts. So we give them mega doses of this vitamin in particular so they don't have to take daily injections. Some people can't absorb it even then and they still have to do the injections. Pernicious anemia is the anemia that is a result of B12 deficiency. And like I said, there's an added risk if you're on a vegetarian diet, but it's specifically a vegan diet. If you get milk products, cheese, eggs, then you're okay on B12. If you don't get that, you may not be okay and need to have some kind of supplementation. All right, that's all the B vitamins. The next one is ascorbic acid, or vitamin C. And this one has gotten a lot of attention over the years about how wonderful it is and how it can save you from being a cold or getting a cold. So we'll look at that just real briefly. It is also a very powerful antioxidant, and it is a cofactor of many reactions in the diet, or in the body. So it is needed every day. You need a dose of vitamin C every day in order for it to do what it needs to do. So collagen formation is important, and then it actually helps with iron storage. So it has gotten a lot of attention about the common cold and that it can prevent a cold. It really can't prevent it, and they've done tons of research on this. So the evidence shows that it can shorten a cold's duration. It doesn't prevent it, but it can shorten the duration of a cold. And it does that by deactivating histamine in the body. So yeah, it might have an effect, but it's not going to keep you from getting sick, but it might make you feel better faster. So, and that would be, drinking juice and taking some type of citrus fruit every day, or else if you want supplementation. There's a lot of stuff out there. When this started coming out, a lot of companies jumped on the bandwagon and started making vitamin C for colds. It's just vitamin C. Stress increases vitamin C needs, so like in the intensive care unit, when I have trauma patients, I use the formulas that have extra vitamin C in it. And they do make, the Nestle girl that was here last week, they make a formula specifically for trauma patients, and it has added vitamins of some of the ones we've talked about today. Scurvy. I can't say it like my son can say it, but you know what I'm talking about. So scurvy is the deficiency sign or disease that's associated with this. Don't see scurvy much anymore. But you might sometime, depending on the patient population that you're dealing with, and this is just some of the signs and symptoms. This is another one if you want to look it up on the internet about the teeth and the gums. Gosh, I don't get blood and stuff, doesn't bother me. I've had surgeons say, come here and look at this, Susan, just to try to make me sick. That doesn't bother me, but some of those pictures I looked at, rotten teeth bother me, okay? And spit. I don't do good with sputum either. But some of those pictures. So I actually got one that wasn't too bad with the teeth, but they're really red. The gums are red, and they may even ooze blood around the teeth. And then you'll see petechiae on their skin, and that's just as a result of the blood leaking, which it will do, and even around the nails on that top one, that's really kind of a result of the blood leaking around the bed of the nails that you'll see that. There's no storage of vitamin C, so that's why it's important that you get that. Okay, minerals. And I just tried to pull out some of the main ones that were important, and then I promised somebody way to calculate free water deficit and all that. So I actually added that late last night. It should be on your all's PowerPoint. Okay, calcium is our predominant mineral in the body. It's the one that we have the most of. If you counted up and weighed all the minerals in our body, this one wins. Most of it is in the bone, and there's a constant turnover due to vitamin D and parathyroid hormone and calcitonin. So those three things regulate the level of calcium in the blood to AT, to keep that calcium at a very tight serum level. These are some of the metabolic functions, primarily tooth and bone formation, which that's something we all kind of know. It's also really important in muscle relaxation. Have you ever seen anybody with a low calcium or a high calcium and you put a blood pressure cuff on them and you pump it up and then their arm will jerk? So you always need to kind of watch. That could be also due to potassium as well, but calcium is a problem with pending. Phosphorus occurs in the bone and teeth in conjunction with calcium. It is also, because of that, very important in bone and tooth formation and the absorption of glucose. Probably its most important characteristic is the way it transports amino acids and fatty acids and the way that it has an impact on energy metabolism. And this is one that sometimes you think, okay, their phosphorus is low or their phosphorus is high. A high phosphorus doesn't really affect us that much. As long as we got good kidney function, we're okay. A low phosphorus, if you're on a ventilator, they're not going to get you off. So you need to always make sure that if you are in the intensive care unit and your patient's on a ventilator, if their phosphorus is like 0.6, which happens a lot, you're going to have to get that phosphorus up before you do anything. And the thing that's important with nutrition, if we have patients in the intensive care unit and a low phosphorus, you have to replete the phosphorus, but you have to stop the nutrition. Because if you continue to give nutrition with a significantly low phosphorus, it will only drop further. The reason is, when you think of phosphorus, think of ATPs. So if you're feeding somebody, they're starting to remake those ATPs and utilizing all that phosphorus. So what we have to do is stop the nutrition, replete the phosphorus, and then you can start it back. But you're chasing your tail if you try to do two things at the same time with phosphorus. We know how important phosphorus is with the buffer system and maintaining acid-base balance. I kind of went through this already because I got ahead of myself, but hypophosphatemia is important. Hyperphosphatemia, if you've got renal insufficiency, your phosphorus is going to be elevated. The only way to get that down is with binders, because hemodialysis and CRRT are not things that pull phosphorus off. So serum phosphorus in renal failure is always going to be an issue that you have to monitor carefully. Magnesium is found in all body cells and is really important as a catalyst in carbohydrate and protein metabolism. So it is very important in growth and development as well. At the bottom, you see malnutrition, refeeding syndrome. You ever heard of refeeding syndrome? Okay, good. Most of the time, people haven't. Refeeding syndrome is when you've got somebody who comes in and they are malnourished when they come in the door. And you start feeding them. And the reason we found this out was a lot of, you know what I forgot to do? I forgot to record this. You want me to start over? You all have questions that you can ask. I'm sorry, I just totally forgot.
See, you were scared to ask now, and I knew she forgot.
Yes, an hour into it. Come on.
Should I stop the recording?
Yeah, you can take a